Hello friends, myself Faruqi Sharmin. Today I am going to tell you about optimal use of drug therapy devices and storage of medicine. So let's start. Learning objectives. Communicate effectively with the patient regarding drug use to improve patient complaints. Communicate with the patient regarding use of devices to improve efficacy of drug. Communicate with the patient regarding appropriate storage of drug to prevent complication or adverse effect. First, optimal drug therapy. Optimal drug therapy aim to achieve the best treatment result by carefully selecting the right medication, dosage, duration based on individual health factor. It prioritizes effectiveness and safety, striving to maximize the benefit of medication while minimizing the potential for side effect and complications. Follow prescribed instruction. Always take medication as prescribed by your healthcare provider. This includes the dosage, frequency and duration of the treatment. Timing is crucial. Pay attention to the timing of your medication. Some drugs should be taken with food while others may need to be taken on an empty stomach. Follow the recommended schedule. Complete the course. Finishing the entire course of antibiotic or prescribed medication even if you start feeling better. Stopping too early can lead to drug resistance. Avoid alcohol and grapefruit. Some medication should not be taken with alcohol and certain drugs interaction negatively with grapefruit juice. Be aware of this interaction. Monitor for side effect. Keep an eye out for any unusual symptoms or side effect. If you have experienced any, report them to your healthcare provider immediately. Use a pill organizer. If you have multiple medication, a pill organizer can help you keep track of your doses and prevent misdoses. Don't share medication. Never share your prescription medication with others, even if they have similar symptoms. Medication can have different effects on different people. Ask questions. If you have any doubt or concern about your medication, don't hesitate to ask your healthcare provider or pharmacist. It's important to understand your treatment fully. Now, drug devices. If you are using medical devices such as inhaler or insulin pen, familiarize yourself with their proper usage. Keep them clean and in good condition. Replace batteries or parts as needed following the manufacturer instruction. First is meter dose inhaler. To use a meter dose inhaler effectively, procedure followed. First, shake it, remove the cap and check the mouthpiece. Breathe out, hold the inhaler upright with your lips around. Start inhaling and press canister. Hold your breath for 10 seconds. Inhale slowly. Wait if more puff are needed. Replace the cap. Then second is nasal spray. To use nasal spray, first you have to wash your hand. Then blow nose gently. Shake spray bottle. Remove the cap. Tilt head forward. Close one nostril. Insert nozzle into nostril. Spray while breathing in. Breathe out through mouth. Repeat for another nostril if needed. Wait before blowing nose and replace cap and then wash your hands. Now, eyedropper. To use an eyedropper effectively, first wash your hand, clean the eyedropper if needed. Then tilt your head back and look up. Hold the eyedropper like a pen. Pull down your lower eyelid. Aim for the pocket created and squeeze one drop into your eye. Close your eye briefly. Avoid blinking for a minute. Repeat if necessary for the other eye. Replace the cap tightly. And now, intrauterine devices. To use IUDs effectively, first you have to consultation. Meet with a healthcare provider to discuss IUD's suitability. Selection. Choose the right IUD type based on your need. Preparation. Undergo pelvic examination and STI screening. Then insertion. The IUD is placed in the uterus taking a few minutes. Follow-up. Ensure correct placement with an ultrasound. Aftercare. Expect mild cramps and spotting for a few days. Regular checkup. Maintain follow-up appointment for IUDs monitoring. Now, auto-injector like insulin. To use an auto-injector, first you have to prepare it, check for damage and ensure it's not expired. Select an injection site, usually the thigh. Remove the safety cap if applicable. Hold the auto-injection firmly. Administer the injection by pressing the button. Hold it in place briefly. Remove the auto-injector and dispose of it safely. Seek medical help if needed. Now, storage of medicine. Store medication in a cool, dry place away from direct sunlight. Keep them out of reach of children and pets. Check the expiration date and discard any expired medication. Follow any specific storage instruction provided by your healthcare provider or on the medication label. Medicine for internal and external use are stored and labeled separately in the cabinet. Properly storing medicine is crucial for its effectiveness and safety. Follow these general guidelines. First, store at recommended temperature between 25 degrees Celsius to 10 degrees Celsius for freezer. Temperature can be maintained in a refrigerator between 2 to 8 degrees Celsius. Keep medication dry. Protect from light, especially for light-sensitive drugs. Use child-proof container if you have children. Keep medication in their original packaging. Check expiration date and discard expired medication. Store different medication separately. Secure controlled substance when traveling. Use original containers. Advantages of storing medicine. Storing medicine correctly in pharmacology has several benefits. First, preserving effectiveness, then ensuring patient safety, cost efficacy and accurate dosing, extend shelf life and preventing drug interaction, promoting medication adherence, aiding in emergencies. Now, time for MCQs. First, how long should you hold your breath after inhaling and pressing the canister? A. 5 seconds, B. 10 seconds, C. 20 seconds, third, D. 30 seconds. Which of the following should be avoided when taking certain medication? A. Drinking plenty of water. B. Eating a balanced diet. C. Consuming grapefruit juice. D. Exercising vigorously. Third, which type of medication should be protect from light? A. Antibiotic. B. Pain relief. C. Vitamins. And D. Light sensitive drugs. Fourth, how should you hold eyedropper when you use it? Like a spoon, like a frog, like a pen or like a toothbrush? Fifth, what is the recommended temperature range for storing most medication? A. 3 to 5 degrees Celsius. B. 10 to 15 degrees Celsius. C. 15 to 30 degrees Celsius. Or D. 2 to 8 degrees Celsius. 6. Why is ensuring patient safety an important benefit of proper medicine storage? A. It saves money for patients. B. It prevents accidental spills. C. It reduces the risk of medication errors and harm to patient. It increases dosage of medication. Now, time for answers. First, A. 10 seconds. Second, C. Consuming grapefruit juice. Third, D. Light sensitive drugs. Fourth, C. Like a pen. Fifth, D. 2 to 8 degrees Celsius. Sixth, C. It reduces the risk, medication errors and harm to patient. Thank you.